Cardiologist warns, never take vitamin B12 with these two common medications after age 60. We have to understand that vitamin B12 is a picky nutrient. It requires a very specific internal environment to be absorbed. Unlike other vitamins that can just slide into your system, B12 requires a highly acidic stomach and a special protein called intrinsic factor to unlock its benefits. As we age, our bodies already struggle to produce these components. When you introduce certain common medications into the mix, you aren't just slowing down the process. You are effectively slamming the door shut on your B12 absorption, leading to a silent deficiency that mimics the signs of much more serious cognitive issues. The first common medication that acts as a B12 blocker is the group of drugs known as proton pump inhibitors, or PPIs, used to treat acid reflux and heartburn. Millions of seniors take these daily to stop the burn, but there is a major biological trade-off. These drugs work by shutting down the acid-producing pumps in your stomach. While this stops the reflux, it also removes the very acid required to unbundle B12 from the food or pills you consume. Without that acid, the B12 stays locked away and simply passes through your system, leaving your nerves and your brain starving for fuel despite your best efforts. Chronic use of these acid blockers is one of the leading causes of unexplained fatigue and brain fog in the senior community. If you have been on these medications for more than a few months, your B12 stores are likely depleted. Your heart and your nerves rely on B12 to maintain their structural integrity and electrical signaling. By understanding this interaction, you are taking the first step toward reclaiming your energy. It is about realizing that while you are solving one problem, reflux, you may be accidentally creating a much larger neurological crisis that can affect your balance and your memory. The second medication on the warning list is a very common pill used to manage blood sugar and insulin sensitivity, often prescribed to millions of seniors worldwide. While this medication is excellent for metabolic health, it has a well-documented side effect of interfering with the way B12 is absorbed in the small intestine. Specifically, it affects the calcium-dependent membrane of the ileum, where B12 is supposed to enter your bloodstream. This creates a mechanical barrier that prevents the nutrient from crossing over into your system, even if your stomach acid is perfectly fine. For a senior, this is a double whammy. You might be managing your blood sugar perfectly, but your feet are tingling, your balance is off, and you're feeling more irritable than usual. These are classic signs of B12 deficiency caused by this common medication. You don't have to choose between your blood sugar and your nerve health, but you do have to be smarter than the average consumer. You must recognize that your body is a complex web of interactions, and adding one pill often necessitates a strategic adjustment in how you handle your nutrition. This is the definition of proactive aging. It is also vital to recognize that B12 deficiency doesn't happen overnight. It is a slow, creeping process that can take years to manifest. Because our livers store B12, you might feel fine for a while, but once those stores are gone, the decline can be rapid. This is why many cardiologists and neurologists are now sounding the alarm. They are seeing seniors with pseudo-dementia or severe walking difficulties that are entirely caused by this drug-nutrient interaction. By being aware of these two common medications, you are putting yourself years ahead of the curve and protecting your independence. We also have to talk about the intrinsic factor challenge. B12 needs this specific protein to hitch a ride into your bloodstream. Many seniors have a condition called atrophic gastritis, where the stomach lining thins out and produces less of this protein. When you combine this natural age-related decline with the two medications we've discussed, you are facing a triple threat to your neurological health. You must treat your B12 levels as a critical vital sign, just like your blood pressure or your heart rate. It is the guardian of your electrical grid. This is why standard B12 pills that you swallow often fail seniors who are on these medications. If the stomach acid is suppressed or the intestinal gateway is blocked, the pill doesn't stand a chance. This leads to a frustrating cycle where you take your vitamins, but your blood tests still show you are in the danger zone. You need a delivery method that bypasses the gut entirely. This is where up-to-date health science provides us with efficient workarounds that can restore your levels almost instantly without relying on your digestive tract. Before we get to that final timed gap protocol, remember that your diet is your foundation. Foods like wild-caught fish, grass-fed beef and eggs are packed with B12, but they still require that stomach acid to be released. If you are on these two medications, you should consider your B12 intake a strategic operation. You aren't just eating, you are navigating a biological obstacle course. Every choice you make about when and how you take your nutrients determines how much brain fuel you actually have for the day ahead. Your heart also relies on B12 to manage an amino acid called homocysteine. When B12 is low, homocysteine levels rise, which can lead to inflammation in your arteries and an increased risk of cardiovascular events. This is why your cardiologist is so concerned about your B12 levels. It's not just about your brain, it's about the very plumbing of your heart. By ensuring your B12 is absorbed, you are protecting your blood vessels from internal rust and keeping your circulation flowing smoothly. This is the holistic, big-picture view of senior wellness. You are the CEO of your own health, and that means you have to look at the fine print of your medications. Never stop taking a prescribed medication without a conversation with your medical team, but use this knowledge to ask the right questions. Ask for a methylmalonic acid test, which is a much more accurate way to check your B12 status than a standard blood test. This level of precision is what allows you to thrive while others are simply getting by. You deserve a body that is fully fueled and a mind that is firing on all cylinders. Now for the timed gap protocol to break the blockade. To maximize your B12 absorption while on these medications, you must take your B12 supplement at least 4 to 6 hours apart from your reflux or blood sugar pills. However, the real secret for seniors is to switch to a sublingual, under the tongue, or liposomal B12. These forms are absorbed directly through the mucous membranes in your mouth or through specialized fat cells, bypassing the stomach and the blocked intestinal gates entirely. This ensures 100% delivery directly to your bloodstream, regardless of what other pills you are taking. By shifting to a sublingual B12 and using the timed gap strategy, you are essentially performing a biological bypass on the interference caused by your medications. You will likely notice your energy returning, your mood stabilizing, and your word-finding ability sharpening within just a few weeks. It is a simple, efficient shift that removes the invisible barriers to your vitality. You are no longer at the mercy of your medicine cabinet. You are the one in control of your nutritional destiny. I want you to feel the empowerment that comes with this knowledge. You don't have to accept feeling old as a side effect of your treatment. You have the tools to protect your nerves, your heart, and your brain simultaneously. These small strategic adjustments are the hallmarks of a proactive, informed senior who is dedicated to living a life of strength and clarity. Your golden years should be a time of peak wisdom and energy, and ensuring your B12 is actually reaching your cells is a vital part of that mission. Take charge of your routine starting tomorrow morning. Check your labels, talk to your pharmacist, and make the switch to a high-quality sublingual methyl B12. Watch as the fog lifts and your stamina returns. You have worked hard to reach this stage of life, and you deserve to enjoy it with a body that is fully supported and a mind that is sharp as a tack. You have the knowledge, you have the plan, and now you have the power to protect your future. Thank you for joining me today and for being such a dedicated student of your own health. It is an honor to help you navigate these complex biological interactions with ease and confidence. If you found this warning about B12 and common medications helpful, and you want to keep receiving the most up-to-date, efficient health tips for your senior years, please subscribe to the channel. We are a community of proactive individuals dedicated to thriving together. I look forward to seeing you in our next video. Stay sharp and stay strong. Make sure you subscribe and join our community of vibrant seniors.